Hello there. So this is part 2 of my hysterectomy story. Part 1 was why I'm having the hysterectomy, and part 2, this is where I'm going to show you guys the stuff that I've purchased for after the surgery. And I'm also going to share what my doctor's office has given me for preoperative instructions. And so why don't I do that first? For preoperative instructions, they said, unless otherwise instructed, don't eat any solid foods after midnight prior to the day of surgery. You may, however, have water or Gatorade 4 hours prior the day of your scheduled procedure. So they called me ahead of time, the surgical center, and let me know that up until 3:30 in the morning, I can have like water. And I actually should probably be sleeping around then, but I also I'm expected to give a urine sample the day I go in, that morning. I have to be there at 6 in the morning, so it's like I can't drink anything after 3:30, but then I'm supposed to be able to give them a urine sample. I don't know. There's no way I'm going to be able to hold my urine for, 3 hours. I mean, I don't know. I'm just going to see. Usually when I'm nervous about something, I don't have any problem peeing, so I shouldn't have that issue, but we'll see. They also said to take 1,000 milligrams of Tylenol the evening before surgery and 1,000 milligrams of Tylenol the morning of the surgery with a small sip of water. Bathe or shower the night before or the morning of surgery. I'm going to get up really early in the morning, and what I think I'm going to do is I'm probably going to take a bubble bath the night before, just so I can try to relax myself. And also, I can't have a bubble bath for 6 weeks, so, and I normally take one every Friday. It's like my little, chill down after the week thing. But I'll probably take a bubble bath tomorrow night, and then Wednesday morning I'll take a shower. They want you to stop taking any medications that interfere with blood clotting, like aspirin, ibuprofen, herbal medications, weight loss medications, vitamin E or fish oil 2 weeks before. So I've already done that. They told me that ahead of time. So I already stopped. I take a daily low-dose aspirin. It says don't wear fingernail polish, makeup, earrings, or other jewelry to the hospital. So I already took all my fingernail polish off, and I'm going to take my wedding ring off. I don't like doing that, but it says don't wear any jewelry. Do not bring valuables to the hospital, except they expect you to bring a form of payment and your driver's license and your insurance card. So like a credit card, I would think would be a valuable. So I'm planning on taking my cell phone, because I don't know how things are going to work out, but if I can share something with you, I'm going to try to. Arrange for a responsible adult to bring you to the hospital. A consent form must be signed before any medication is given. I've got my husband, and then they want you to let them know if there's any change in your physical condition prior to the surgery, like if you get a cold, a fever, an infection. And yeah, please bring your insurance card and or claim forms with you to the hospital. So that's my pre-operative instructions. Then they also sent me some things for afterwards, and this is where I purchased the items I purchased, was based on things they said. And also I made a list here when I was looking at different videos and advice I've been given, things like that. So I have a list of things that I got based on all that stuff. So they said there are 3 basic rules for the first 4 to 6 weeks following your surgery. No heavy lifting or straining, don't become overly tired or fatigued, and no sexual intercourse, and nothing in your vagina. For the first week, your activity level at home should not be any greater than it was in the hospital. Not really going to be in the hospital, but I'm assuming in the recovery area. You should gradually increase your activity level as the week progresses. Walking and a gradual increase in activity will speed up your convalescence, prevent constipation and thrombosis, which is blood clots. Drink at least 6 to 8 glasses of water a day. This will avoid urinary tract infections and constipation. And that was one thing I forgot to mention yesterday. I don't know where my paperwork went. She said they will also be she'll be doing the hysterectomy, and then she's also going to do a cystoscopy where she'll make sure that my bladder didn't get damaged during the surgery, which I think they put like fluid in and make sure there's no perforations or anything in there. So I do have cranberry juice for afterwards, because that was one of the things that several of the women had talked about is you'll have a catheter, and then them doing that procedure could increase your chances of a bladder infection. So they had really good luck with cranberry juice. So I've gotten some of those things. It says you may take showers and wash your hair. Do not drive. This is the first week here. Do not take a tub bath, douche, or use tampons for 6 weeks. Why would you use tampons? I understand there's supposed to be, possibly some bleeding afterwards, because the top of your vagina, when they remove the cervix, that's open, and so they sew that up. It's called a cuff, and so that incision could have a little bit of bleeding for a while. So I planned on having a pad or a panty liner, just depending on what kind of bleeding that is, but I can't imagine anybody that would want to put a tampon up there or douche or anything like that, but it's good that they tell you just in case. It says you may go up the stairs and down once or twice daily is plenty. We don't have stairs in our house, so that's fine. The second week, you can go for short rides in the car, but don't drive. Increase your activity level, but still avoid fatigue. The third week, you can drive and include non-strenuous activities away from home. So the third week, I'm thinking, is probably when I can go ahead and go back to the gym, but all I'm planning on doing is walking on the treadmill. I'm not going to do any weights or anything like that. For the incision, it says keep your incisions clean and dry. From my understanding, I'm going to have 3 incisions on the outside and 1 inside my vagina, which of course you can't keep that dry. So you may change the Band-Aids after 24 hours. Some swelling, soreness, and possible bruising around your incisions is quite normal. For discomfort, you may need a pain pill, which you will receive before you are dismissed from the hospital. A heating pad may also be helpful. I've been using the hell out of heating pads. I have, because a lot of times when I'm in a lot of pain, a heating pad feels really nice. Discomfort. It says a vaginal discharge, which may be slightly bloody, is normal up to 4 to 6 weeks following surgery. Should you start any heavy bleeding or clotting, have a temperature elevation, or increased pain, notify the office. Following surgery, especially when you are taking pain medications, you are more prone to constipation, and you may need to take a stool softener or laxative, Colace or Paracolase, for a week or 2. I'm not even going to take any chances. After I had my 2 kids, I took the stool softener, and I never had to worry about the constipation, so I'm just going to take it. It's not going to hurt. You will probably have some abdominal distension and gas for up to a week, usually 3 to 4 days. Phazyme or Milacon may help relieve the gas. So what they do, my doctor told me, and for any laparoscopic surgery, like in the abdomen, they pump your abdomen full of gas, and that kind of pushes everything out of the way. She also said they're kind of going to tilt me upside down. I don't think like this, but up enough where the intestines will go up like towards my ribs. So that'll be out of the way, and so we won't have to worry about like a perforated intestine. But all that gas, then they try to get out as much as they can after the surgery. I think while you're still out, but then there is some that still hangs around. And I remember that from years ago when I got my tubes tied. But a lot of the ladies that I watched had some really bad problems with that, and some of them, the pain goes clear up into their shoulders and stuff, so I'm going to try to head that off. And then it says, basically to call the office if you're going through more than one pad an hour, have a fever greater than 101, vomiting, chest pain, shortness of breath, or any further concerns. Hopefully I won't have any of that. And then to call the office as soon as possible for the post-op appointment, which is 2 to 4 weeks following your surgery. So I imagine I'll be getting, and then I know that you get some like post-operative instructions like that they'll give my husband. And then the surgical center also sent a little pamphlet that basically said the same kinds of things that did, except it starts talking about billing and all that because they want their money. So all that, here are the things that I have. So first off, this is actually something I already had. It looks new, but it's not. We just kept the instructions on here. It's one of those grabbers, and this one's actually lighted, and I got this quite a while ago from Target. They actually had it on clearance over in their As Seen on TV stuff. So I've got this. If I need to pick up anything, I can do that without bending. The next thing I have, I don't know if I'm going to need to use this or not, but there were a few women that talked about having a wedge like behind your pillows in your bed because it would be easier to kind of be elevated a little bit. Because it sounds like you have to lay on your back a lot because it's really uncomfortable to be on your sides. I'm normally a side sleeper. Well, I did not have to purchase one because my mother-in-law had one. It's actually still in the packaging and everything. So it's a wedge that you put in your bed, and then like this part goes up towards your head so that you're slightly elevated. And so, like I said, it's still in the packaging and everything. And so she let me borrow that. I will let you know if that helps. There were a few women that I saw that got those. They're kind of pricey, so I'm really glad she had one. Otherwise, I would have just used like a bunch of pillows to try to prop myself up. Another thing people have recommended that I don't know if I'll need is a belly band. So I did buy one. I got this one off of Amazon, and it's like, I didn't realize it was in multiple pieces, but it tells you it's a 3-in-1 postpartum support. And so I'm thinking I might only need one part of it, but it's like different widths. So there's like this one, and then there's a little bit smaller of one, and then there's even smaller, the next is smaller. So depending on where my incisions are will determine which one of these I use. I didn't realize it was going to come like this. So I got a belly band. Don't know if I'm going to use that or not, but we'll see. And then one of the things I kept seeing get referenced was mesh underwear. Because you don't really want to have anything that's going to rub on the incision, and it needs to be up a little higher. And I don't know where my train of thought was going there, but I priced mesh underwear. They're not cheap. And then I started seeing ladies that were like, you know what? I got the mesh underwear. Don't do it. Just buy underwear that are too big. So what I did, they suggested buy underwear that are 2 sizes too big. Now, I got a 9-pack because it was cheaper than like the 3-pack or whatever. And plus, if I'm going to be needing them for a few weeks, 9 pair will probably be good. But I got like the cotton briefs, and I got them 2 sizes too big. So I'll let you know if that works. If not, I don't know what I'm going to do, but I'm sure this is going to work. So I got some underwear for afterwards. I'm going to take a pair of those to the hospital with me. I'm thinking maybe they'll give me a pair of like mesh underwear to wear home, just based on other people's experiences. I don't know. Like I mentioned before, this is kind of like, actually I got cranberry juice, but I'll wait because I want to show you. We have a step stool, so this is going to be next to my bed because our bed sits up kind of high, and I don't want to strain my abdominal muscles when I'm getting in and out of bed. So I have a step stool, and I've actually been using this for the last couple of weeks just to get used to it, and I've been practicing not using my abdominal muscles and everything. So got that. Then for coming home from the hospital, I bought these are one size too big. These are so soft. They're from Target, the Stars Above brand that they have, and they're just really super soft. If I had, like, I don't know, I was thinking about packing these, and then also I think I'm going to pack like a nightgown just in case, because if I find that this is just too much for that area, then I'll at least have an alternative. But these are so cushy soft. Also, here's one of my heating pads. I have this one, and then I have one that's like twice this length that's green. So I got my heating pad. Then here's what I was going to show you. I got some cranberry juice. I got some cran grape. I love cranberry juice anyway, so. And I got some cran pineapple. This is new. My husband and I saw that, or it's new to us, and he wants to try this one too. And then I have, this is probably what I'm going to start with. Just plain cranberry that's like in the individual. So then I can just have him bring me some of these. But I need to put these in the fridge anyway to prepare. They were not in the fridge yet. So then before I got the instructions from the doctor's office, I bought these based on recommendations from some of the ladies I'd been reviewing their videos and stuff. Says they're extra strength, and for the simethicone, there's 125 milligrams. It's an anti-gas. But then my doctor's office recommended, not that, they recommended Phazyme, and it's twice as much. It's 250 milligrams of the simethicone. So I'm going to go with these and still keep these because, you know, sometimes you just need them for day to day. Just life. And then another thing to help with gas is people were recommending peppermint tea, which I love tea. I'm a big tea drinker. So this is easy, but I got some peppermint tea because I didn't have any. Got some, this is the generic version of Tylenol, because they had talked about, like I said, you have to take some before the surgery and then some the morning of the surgery. And several of the ladies said that this, if you alternate this, like when they prescribe pain pills, take a pain pill, and then the next time you're due for a pill, take Tylenol, and then just keep alternating them, and that would help with like any constipation and stuff. So, and then I got Dulcolax, a stool softener. So, and actually, I have had the Colace before, and it's the same active ingredient. It's just these were on sale, and you got a bonus 20%, so that's the only reason I went with these. And then I got just this little basket that I'm going to set up on my bedside to put different little things in and stuff. So I think that's everything I got to kind of help prepare me. I'll let you know if I don't use something. I'm also going to try to go to my Amazon orders and get the link for this belly band, because that's where I got it from. Was one of the videos that I watched, the lady had put the link, and this one seemed like it was reasonably priced, and she really liked it. I think I've seen a couple of people. And then some of the other videos were older and the links didn't work anymore, or the belly bands were just kind of expensive. So, and also I like how these like hook with Velcro. some of them seem like you kind of had to step into them. So I'll go through and I'll get the link and put it down below for you. I don't think any of these other things would, like my heating pad I bought at Walgreens. It's actually the Walgreens brand. My green one that I have, you can buy at everywhere. I mean, they've got them all over the place, but it's just like this. You can look them up. These were Target. Target, you know, most of the stuff's Target. I have no idea about the wedge. And then the grabber, those are all over Walmart, Target, that kind of stuff. You can even look on Amazon. And the step stool is Target. I'm a huge Target fan, in case you can't tell. But the belly band, that's something that I haven't seen in the stores. So anyway, I will quit rambling, and if you can think of anything else to let me know about or any questions, just let me know. And then Wednesday will be surgery day, and yeah, I'm very nervous. But thanks for stopping by. I hope this helped.